Today we have two of Therapedia's wonderful OTs, Kelsey and Aicha, and they're going to tell us how they became OTs. Aicha, can you tell us about the education needed to become an OT?
Sure. So you first start off by getting a 4-year degree. Normally it's a bachelor's degree, and you usually do it in any type of health science field, or sometimes some schools offer you a pre-OT track as well. And then afterwards, after you graduate with your bachelor's degree, you decide you want to go to OT school. You would have to then take the GRE exam, which is essentially like the SAT for graduate school. And from there, after you get your test results, you would apply to different OT schools. At this point, you would go through different interview processes, application processes, submitting lots of different documentations and transcripts and things like that to then hopefully get accepted into one of the schools. So there's a couple different options for OT schools. There's master's level program and there's also doctorate level programs. So the length of schooling does vary. It's generally around 3 years, but it does depend on if it's an accelerated program or not. And during schooling, you do get field work level experience or clinical level experience. So it's required for us to have 3 level 1 fieldwork level experiences, which is essentially us observing different clinicians in different settings. And then we have 2 level 2 fieldwork experiences, which is basically when we work as a clinician for 6 months under the supervision of a licensed OT.
Okay, and then after you graduate, Kelsey, what do you need to do from there?
Okay, after you graduate, you have to take your national board exam. So basically, this is just an exam that all OTs have to take and pass in order to work as a OTR. After you pass this exam, then you can apply for licensure with your state. You have to apply to each state that you work in, but you have to get your licensure before you can practice. And then once you have taken your boards and you've been licensed by the state, um, then what you have to do is take continuing education courses so that way you can maintain your licensure. So you have to make sure that you're hitting the allotted amount of hours every renewal cycle.
Great, thank you so much. That